Welcome to Permission to Breathe, a transformative podcast dedicated to providing a safe space where you can inhale deeply and exhale freely while embracing your grief journey unapologetically. I am your host, Dr. Tammy Isaac, a spiritual practitioner, grief advocate and educator, author, and your guide on this journey through grief. This space was born out of the understanding that grief is not just an event, it's a lifelong unfolding. It's layered, it's complex, and often it's silence. And here is where we disrupt the silence. We will talk about the grief that lingers after the food stops arriving at your door, the grief that remains when no one calls and no one comes by to check on you. The grief that's complicated, the grief that's ancestral, the grief that lives in your body long before it ever reaches your tears. Every episode, we honor the humanity of grief, the anger, the confusion, the numbness, the longing, and we do so without apology. Whether you're navigating fresh loss, unspoken sorrow, or the weight of a world that just won't pause, this podcast invites you to sit down, breathe deeply, and give yourself the permission you've been waiting for to grieve, to feel, to breathe. Let's begin. Are you grieving and feel like you're struggling alone? You don't have to walk this path by yourself. Book a virtual session with Dr. Tammy Isaac at Breathe Grief Counseling Center. Visit us online at www.breathegriefcounselingcenter.com. Dr. Isaac will help you put your emotions into words. She'll help you reduce the feeling of isolation. She'll help you understand that everyone grieves differently and also help you prevent unhealthy coping mechanisms. Take control of your life with world-class counseling sessions today with Dr. Tammy Isaac. Hi, and welcome back to the Permission to Breathe podcast. Today's episode comes straight from my heart and from the front line of healthcare. I recently had the honor of presenting at the UTMB 2025 Nurse Compass Conference, where I shared a message titled, "You See My Scrubs, Not My Scars. Who Heals the Healers?" This episode today is a reflection of that presentation. This episode is for every nurse who has shown up with compassion while quietly bleeding beneath their scrubs. And it is also for those of us who are called to support them. Now, let's take a deep breath and let's begin. Before we can talk about healing, we have to name what's hurting. Right now, we are facing a silent epidemic within our hospitals and healthcare systems. Not a disease of the body, but a wound of the soul. This epidemic hides in plain sight. It wears scrubs. It administers meds. It comforts families. And it smiles behind surgical masks. It's the epidemic of nurse grief. A 2025 study by Cross Country Healthcare in Florida Atlantic University reported that 65% of nurses experience high stress and burnout. The NCSBN's 2024 workforce found that nearly 4 in 10 nurses plan to leave the profession by 2029. The suicide rate among registered nurses is 16 per 100,000. This is a heartbreaking reminder that behind the role is a human being. But here's the thing, the numbers don't tell the whole story. They don't show you the nurse who cries alone in the supply closet after losing a longtime patient. They don't capture the emotional numbness that settles in after witnessing trauma after trauma, shift after shift. They don't reveal the guilt, the helplessness, the quiet despair that builds when you're expected to show up strong every day while breaking on the inside. Nursing is one of those few professions where grief is part of the job description, but it's not written down anywhere. When a patient dies, the chart gets updated, the bed gets turned, but where does the grief go? Often it stays stuck in the body, heavy on the heart, pushed aside to get through the next task. Grief becomes background noise until it becomes burnout, disengagement, or departure. This isn't just about staffing. It's about souls. It's about how we treat the people we trust to care for others. And if we're going to ask nurses to carry so much, we have to give them space to lay down some of it. It's easy to admire a nurse's uniform, the crisp scrubs, the badge, the calm tone that steadies a frantic moment, the efficient way they chart, console, clean, and carry the weight of care. But underneath those scrubs, there are scars. Not the kind that you can see with an x ray. These are emotional bruises, invisible fractures of the spirit. And they are often ignored because nurses are trained and praised for their strength, not their sorrow. So let's take a moment and pull back the layers. Beneath those layers is a world of unspoken pain, scars that aren't visible on imaging scans, but are deeply embedded within the soul. Nurses carry an emotional terrain shaped by continuous exposure to human suffering. Emotionally, they navigate a world of complex and often conflicting feelings. Sadness after the death of a patient that they bonded with, anxiety when the staffing is dangerously low, helplessness in situations where medicine fails and there are no answers, guilt, even when they wonder if they messed something up or didn't do enough. And sometimes the emotional toll becomes so overwhelming that it leads to a kind of emotional numbness, not because they stopped caring, but because caring has cost them so much. One study in BMC nursing noted how these unresolved emotional experiences, especially when compounded by frequent patient losses, can create a lasting spiritual disconnection and a pervasive sense of self doubt. Professionally, grief doesn't stay in its own lane. It seeps into productivity, decision making, and even the ability to offer genuine presence to patients. It all alters clinical judgment, slows reaction time, and darkens once hopeful worldviews, right? According to BMC Health Services research, this type of grief fatigue disrupts workflow, damages team collaboration, and can lead to high turnover, often masked as, burnout, but rooted in unacknowledged sorrow. Behaviorally, nurses may start to pull back. They may avoid patients or units that stir painful memories. They may even emotionally detach or unusually quiet, going through the motions while carrying the weight of yesterday's code blue or last week's hospice case. And many don't leave the pain at work. They carry it home, replaying events in their minds long after the shift has ended. This pattern, as reflected in BMC Palliative Care 2022, underscores that for many nurses, the emotional residue of care lingers long past clock out time. Now, physically, grief speaks through the body. Persistent fatigue, tension, headaches, digestive issues, and a generalized feeling of heaviness will often show up not just as stress, but as the body's grief response. These symptoms are frequently minimized or misdiagnosed, yet they are the tangible expressions of what the heart and spirit has been holding. And perhaps most alarming is the cumulative effect when one loss is layered upon another with no space in between to process, mourn, or even recover. This kind of grief overload identified by the ONS Clinical Journal, can evolve into complicated grief or emotional shutdown, leaving nurses emotionally brittle and dangerously close to walking away from the profession altogether. This is not just emotional strain, it is trauma. Unattended grief becomes a quiet wound that deepens with every patient death, every failed cold, every moment of moral distress. And when healthcare systems fail to make space for grief, they unintentionally ask nurses to carry the unbearable alone. So when we say, "You see my scrubs, not my scars," this is what we mean. You see the caregiver, but not the grief. You see the skill, but not the suffering. And if we are truly committed to caring for those who care for us, we must begin by acknowledging the emotional toll and by offering a way to begin healing it. This layered grief is real, it's deep, and it's asking to be named. When grief begins to cloud a nurse's clarity, when exhaustion becomes spiritual, and when no one seems to notice the quiet unraveling, this is where the chaplain steps in, not as a savior, not with quick fixes, but with presence, with stillness, with compassion that doesn't require performance or explanation. Often misunderstood as being only for end of life patients or religious services, chaplains actually serve a much broader and deeper role in healthcare systems. We are trained to meet people at the intersection of emotional, spiritual, and ethical distress, regardless of faith background or belief system. And for nurses who often operate in crisis mode, the presence of a chaplain can be grounding. We become that steady anchor in the storm. The role of the chaplain dates back centuries to the city gates of Amiens in 337 CE, where a Roman soldier named Martin tore his cloak to share it with a beggar. That shared moment of humanity was the beginning of what we call chaplaincy. And the call hasn't changed. We still stand at the gates of life, of loss, of meaning, and offer care even when there are no answers. Today, within hospital walls, chaplains help nurses reconnect with their own anchor. Where the work is too heavy, we hold space. When emotions are overwhelming, we offer sacred silence. When ethical dilemmas shake a nurse's sense of right and wrong, we sit in the ambiguity with them. According to the Journal of Religion and Health, chaplains significantly reduce compassion fatigue and spiritual distress among healthcare workers simply by showing up and listening without judgment. Our support is both emotional and ethical. In the Journal of Healthcare Chaplaincy, the writer points out that chaplains help nurses reflect on moral complex decisions. We don't give answers. We help staff reconnect to their values, their why, their inner compass. During crisis, whether a code blue, a traumatic loss, or an overwhelming shift, chaplains respond in real time. We provide grounding through breathing, brief spiritual rituals, or just quiet company when words would only get in the way. The Healthcare Chaplaincy Network notes that chaplains who provide crisis support for staff not only decrease distress, but also improve long-term emotional regulation. Then there's the power of ritual, from grief debriefings to communal prayer circles to tea for the soul moments. Chaplains offer intentional pauses in a field that rarely slows down. These rituals aren't about religion, they're about remembrance, reflection, and human connection. In the Journal of Pastoral Care and Counseling, the authors remind us that after events like COVID-19, these staff focused rituals became lifelines, restoring meaning and dignity in the workplace. And chaplains don't operate in isolation. We are collaborators. We sit on committees, support hospital initiatives, and co create care plans that include the emotional and spiritual well being of staff, not just patients. As noted in the BMC palliative care, chaplain collaboration with nurses leads to better holistic care outcomes across the board. So, when we ask who heals the healers, the answer is never just one profession. It's a community of support. But chaplains play a vital role, often underutilized role in that healing process. We show up not to fix, but to witness, to hold, to remind nurses that they are not alone and that their pain matters too. In a system built on outcomes, chaplains make space for what can't always be measured: grief, meaning, hope, and the sacredness of being seen. As powerful and healing as chaplain support can be, the truth is many nurses never access it. Not because they don't need it, but because real barriers stand in the way. One of the most common obstacles is time. Nurses are stretched thin, often caring for too many patients with not enough staff. Carving out even 10 minutes to pause, let alone to debrief with a chaplain, can feel like a luxury they simply can't afford. The pace of modern healthcare leaves little space for stillness, so the grief piles up unchecked simply because there's no margin to address it. Another barrier is awareness. Many nurses don't fully understand what chaplains do or assume that our services are reserved for end of life situations or religious needs or strictly to patients only. Some believe that because they aren't spiritual in a traditional sense, we have nothing to offer. But chaplaincy isn't about dogma. It's about presence, dignity, and making room for what's human in all of us. Without clear communication from leadership and clinical teams, this misunderstanding continues to keep chaplain support in the shadows. Then there's resistance, both internal and cultural. In some units, there's a deeply embedded culture of silence around grief and emotional struggle. Vulnerability is seen as weakness. Asking for support is viewed as not being able to handle the job. This stigma reinforces the harmful notion that suffering is just part of the profession and that the only way to survive is to hearten. In that environment, the chaplain's offer of care may be quietly declined, not because it isn't needed, but because the cost of being seen feels too high. And I have found this to be extremely true, especially among the ER staff. So, how do we build bridges across these barriers? It starts with integration. Chaplains must be visible, not just when tragedy strikes, but in everyday rhythms. Attending unit meetings, participating in shift huddles, being present in the break room. These everyday moments build trust. When nurses see chaplains as part of their team, not as an outside resource, they're more likely to reach out when it matters most. Next, we must normalize debriefing. It's standard Just as it is standard to debrief after a cold, we can normalize emotionally processing after difficult shifts or traumatic cases, creating protected time for reflection. Even 5 minutes at the end of a shift can extremely change everything. It says to the nurse, your feelings are part of this work and they deserve space. Healthcare leadership also plays a critical role. Organizations must clarify the chaplain's role, offer education about the value of spiritual, emotional care, and create policies that allow time and space for staff to engage in it. This isn't just a wellness initiative. It's a matter of retention, safety, and long term mental health. Barriers are real, but they are not immovable. When we prioritize humanity in our systems, when we say that healing the healers is not optional, we begin to reimagine a culture where grief is not a secret burden, but a shared experience held together with compassion. And that's when chaplaincy becomes more than a service. It becomes a bridge back to hope. You see my scrubs, not my scars. This phrase isn't just poetic. It's a quiet truth whispered in break rooms, swallowed in shift huddles, and buried beneath professionalism. It speaks to a workforce that is holding so much silently. Nurses are showing up, giving care, extending compassion, but many are doing it while quietly unraveling on the inside. So the question remains, who heals the healers? This is not a rhetorical question. It's a plea, a challenge, a call to action. We cannot keep asking nurses to absorb grief like sponges and expect them to keep functioning as if they are not human. We cannot demand that they show up for death, trauma, and heartbreak over and over again and offer them nothing but an extra shift and a badge of honor. Nurses are not machines. They are not invincible, and they were never meant to carry all of this alone. And we must also remember, nurses don't leave their personal lives at the hospital doors. They come to work carrying the grief of divorce, of caregiving for aging parents, of losing a child, of broken relationships, of trauma in their own bodies. They show up after miscarriages, after funerals, after sleepless nights tending to their own sick loved ones. The grief they carry isn't just professional, it's profoundly personal. And when their workplace doesn't make space for either kind, it compounds into a quiet, chronic sorrow that becomes harder to name and even harder to heal. If you're a leader, whether in administration, nursing, or spiritual care, this is your moment to pause and take inventory. What systems are in place to allow nurses to process grief? What rituals have you created to honor loss? Do your nurses even know they can talk to someone without fear of judgment or retaliation? The time to act is now. Embed chaplaincy into your culture, not as a crisis response, but as a standard of care. Make debriefing normal. Offer protected moments of reflection. Educate staff on the emotional toll of caregiving and make emotional support just as accessible as PPE. Track well-being metrics the same way you track clinical outcomes. If your staff are emotional bleeding, no amount of clinical excellence will be sustainable. If you're a nurse listening to this right now, I want you to hear me clearly. You are allowed to grieve. You are allowed to feel. You do not have to perform strength while silently suffering. Your tears are not a liability. They are evidence that you are human and that your humanity is intact. There is no shame in needing support. There is only danger in pretending that you don't. Let this be the moment where we stop glamorizing burnout and start dignifying emotional honesty. Let this be the shift where you ask for what you need and where someone actually listens. Let this be the season where your scars aren't hidden, but honored. Because healing begins when we are finally seen, not just for what we do, but for what we carry. As we close this conversation, I want to leave you with a truth that often gets overlooked in healthcare settings. Caring for others does not mean you should neglect yourself. The stories we've explored today aren't hypothetical. They're real. They are happening in break rooms, behind medication carts, in supply closets where tears are wiped away in silence. Nurses are holding it all together, often while falling apart on the inside. And what's worse is that many have been conditioned to believe that this is normal, that this is just the cost of the calling. But it doesn't have to be. Grief, whether personal or professional, is not weakness. It's evidence of your humanity. It's what makes your care real. But when it goes unacknowledged, when there's no space to process or be supported, it becomes coercive. It wears away at the soul, and it will show up in ways that are hard to reverse. Burnout, disengagement, compassion fatigue, and sometimes walking away from the profession altogether that you once loved. That's why this work matters. That's why chaplaincy matters, because healing the healer isn't just a nice idea. It's a necessity. So whether you're a nurse, a hospital leader, a fellow clinician, or someone working in support services, ask yourself, what would it look like to create space for grief in our workplace? How can we show one another that it's okay to not be okay? These aren't just emotional questions. These are questions of sustainability, retention, and well-being, and they demand answers. We owe it to our nurses and to ourselves to build systems where people aren't just praised for their strength, but supported in their struggle. The scrubs may be uniform, but the scars are personal. Let's not overlook them. Let's commit to seeing the whole person behind the scrubs. Thank you so much for joining me today on the Permission to Breathe podcast. I hope today created space for you to breathe and find peace on your journey. I invite you to join me again next Monday for another episode as we continue to navigate this path together. Don't forget to like, subscribe, and to share the podcast. Until next time, take care and keep breathing unapologetically.